Okay, it's now time to follow, and you're welcome, Cathy. And it's my pleasure to welcome Professor Valérie de Vauchel. Professor de Vauchel is a professor of rheumatology in Brest University Hospital, and she also leads the Rare Disease Reference Center in Brest, in France. Thank you, Valérie.
No, not yet. But during this time, I want to thank really Coralie, of course, not only Coralie, but also Cathy, Masha, and Joyce, and maybe Hannah too, to organize this. I'm very proud to be there, and I'm very touched to have been invited for the first Sjögren Europe meeting. That's very good idea to do that, very big challenge, so I'm happy really to be there. And so we are going to discuss together, and Coralie asked me to respond to the question, what is the frequency of Sjögren syndrome? So what we are going to do together, because if I understand now we are working closely together, how to count the patients, and I will present you the data concerning Sjögren patient, and why counting the patient. So first of all, the patient also mentioned that sometimes it's difficult to discuss with a doctor, but be sure that sometimes for us it's difficult to have a good level, and we have to do mathematics and statistics, and sometimes we don't like that, but we have to do that. And for epidemiology, we are going to see together some definition. Yes, Coralie, I know you love mathematics and statistics. So first of all, to understand how to count the patient, you must understand that we use two different terms. It's prevalence and incidence. The prevalence is the number of patients. It's the percentage of a population, whatever, affected by a particular disease and during a specific time. And we count all the new case, the old case, everybody. And then we reported the prevalence as a percentage, or sometimes the number of cases. I'm going to use that after. The number of cases per 10,000 or per 100,000. And then we are using another term that is incidence. It's incidence rate. This is quite different. It is the number of new cases for one disease and for a specific population and also during a specific time. And finally, the incidence represents for you the risk to develop a disease. And we express that in person, years, incidence. So now everybody know how to do. So let's try to calculate the incidence and then the prevalence. So here is a group of Brittany people. I'm coming from France, the western part of France, and there are some typical costume and some specific days where some women, more women, no men in this group, are dressing like that and having a big party together. So in this group of women, aged from approximately 50 or more than 50, one, she's called Nolwenn, a Brittany surname, Nolwenn, has Zika symptoms. So in this group of 5,000 women, one woman has Zika symptoms. So I'm going to calculate the incidence. So she has Zika symptoms for a long time. So I'm not interested in counting her because for incidence is the new cases, you remember? So in the group, during 1 year, we are going to look at the group for 1 year and ask them who has Sjögren or Zika symptom, it was Zika symptom here, who has Zika symptoms. And during this year, 2 women developed Zika symptom. It's Marie and Morgan. So 2 new cases. So I calculate the incidence. It was 2 new cases divided by 5,000, and so 0.0004 people year. So that's what we are doing to calculate the incidence. And after that, we told you the risk is of 0.04 to develop Zika symptoms. And here, so what is the prevalence? So how many cases are we going to count to calculate the prevalence? So maybe Coralie, that is good, mathematics. How many cases? Remember, Coralie.
Well, let's say 3.
Yes, exactly. She's very good. For prevalence, I'm going to consider Nolwenn, I'm going to consider Marie, and I'm going to consider Morgan. All the women who still have Zika symptoms. So the prevalence will be 0.06. So that's what we are doing when you calculate incidence, new cases only, and prevalence, all the women here who have Sjögren. Then I can do other things if I want to calculate. I want to calculate the number of Sjögren patients in this group of population. So what are you going to tell me? But what are you doing, Valerie? It has no sense. They're babies, so they are not concerned. Okay, so when I calculate the incidence and the prevalence, I have to use the good population, okay? I'm not going to calculate it in this population, for example. So the population that we are studying is very important. After that, when we want to calculate also the number of patients, it's not really easy for the doctor. That's why I explained that to you. We can say, okay, how to calculate? We don't know. It's probably a rare disease. So we can calculate the number of patients that are seen by a doctor. For example, as I am an expert in Sjögren, we can calculate the number of patients that are seen by Valérie de Vauchel in Brest in France. So here is my outpatient list. So I have Marie, you know, Nolwenn, you know her too, Morgan, you know her, she was at the party, and Venus William, because I'm very famous doctor for Sjögren, okay? And I'm also a very famous woman, so Brad Pitt come also to my consultation. However, if you calculate, so you see that I don't work a lot, but I see many, many Sjögren patients. So if you do that, you will make a mistake. You are going to calculate in a specific country, in a specific place where Sjögren are coming, because we have a center of reference. So it's also not very good to count like that. If I see Brad Pitt, I will show you a picture.
You will invite me.
Yes, I will invite you, Coralie, immediately. I need a patient partner. Yes. Another way, but there are many, many problems when we want to calculate. So, for example, how to define the sample design. How to define that you, that me, that Coralie has or does not have a Sjögren to count. And in some country, doctors don't use ultrasonography, and we know that it increases a little bit the number of Sjögren patients. In some other country, the doctor don't use a biopsy. I hope not systematically. We don't have the same patient. In some country, we use insurance, and we calculate like that. It's the best way, but we have to have a registry with healthcare or with insurance. In some country or in some study, we use hospitalization or treatment. Not easy in an orphan disease where we don't really have treatment. And also, we can do survey. Okay, I can send to all the people living close to Paris a questionnaire asking, do you have Sjögren or not? And many people frequently answer yes, but they do not have. Okay, so survey questionnaire is not really a good way to calculate because we have to verify it's true. So here is all the problem that we have to calculate. So the best way is to have, you understand, a large population and to mix the data. It is case finding or case assertment. We are going to be sure to ask again to verify that it's really a Sjögren. And we define some population, some algorithms we call that algorithm to say it's Sjögren because he has anti-nuclear antibody, he had ophthalmic consultation, he had a treatment, a teardrop or something like that. So it's not good to use small sample and questionnaire survey. So what do we know about Sjögren? And Coralie, you check the time. I don't want to speak too long time. Thank you. So for Sjögren, what do we know? So is it frequent, not frequent? Do we know? Do we have some data? And just to remember, in Europe, the prevalence of a rare disease is 1 on 2,000. So you have to be below this level to be considered as a rare disease. So in France, when you are rare disease, it's quite different because you can have a specific financial support for research, for example, and for the doctor, it means you are going to do a design for trial that is going to be a little bit different than having many people. Okay, you have to think about the design of the study to be sure you are going to include patients in your study. For example, we had some results for epidemiology in USA, in Rochester country. A study was performed 5 years ago, and they find a prevalence, you can read it, the prevalence of 10 per 10,000. So it's not a rare disease. And it was done using like a survey. And after that, when the experts read the survey and really apply the classification criteria for Sjögren, the prevalence was 10 per 10,000. So now it's rare. So you can see that depending on the way you choose the patient, the number is different. In Europe, what do we have in Europe? We have 3 studies in Europe. Sorry, it's, you cannot read, so you have to be confident with me. So we have three studies, and one of the best was this one, performed in Paris, with a lot of way to, we call that capture and recapture. It was based on health insurance, but the patient were verified to be sure they had Sjögren. And when we are doing that, the prevalence decreased. And so the mean prevalence is written here. It's a secret, you cannot read. It's, it's 38, so it's below 50. So it's not really frequent in Europe. And other people do other analyses. They perform meta-analysis. That means they are going to read all the studies that has been performed by everybody in every country. They read them, they say, it's well done, it's not well done, we keep it, we don't keep it, because the methodology is correct or not. And so they are doing that, and after that, they say, okay, we keep this one, this one, this one, and we analyze the results. So they consider only 21 studies, and they analyze the results. And they show us the prevalence, so the global prevalence was 61, so more than 50. But I'm so sorry that you cannot read the data here, but the number were really, really different. For some of the study, it was 100 per 100,000. For the other, it was 10. So really different depending on the country and on the methodology. So it is the global prevalence they calculate, but when they eliminate some study with sample survey, you can read it, sample survey, it's questionnaire. You send questionnaire to the population, and the answer, the prevalence was 284. It's enormous. And when you eliminate this and only consider the analysis that confirm really it was Sjögren, not only by questionnaire, the number was lower. And it was the same for population size. When they only consider really, really, really small size, the number was really elevated. So when they eliminate the bias, the prevalence was decreased below 60. They also analyze different things. I just show you the number of patients, the prevalence, but of course we can analyze different things. And for example, they analyze the gender, and of course you can see, you know that women are more affected than men. And also the peak, the mean age was 60 to 70 years. They also looked at ethnicity, and I have written probably, because it was considered that Asian women seems to have more frequently Sjögren than European or Caucasian women, and more than Latino American women. But recently, a study was performed in Korea and showed a low prevalence. But they did a study, as I mentioned to you, healthcare and capture and recapture, they verify the data. And the prevalence was lower than the other prevalence by performed previously with Asian patients. So maybe Asians are more affected, but we don't know exactly. So we are really interested in this in our center. So we published different data on that. And we recently performed another study with Raphaël Serror and with Laurent Schiss, with some colleagues in France. And we looked on the French National Healthcare Database. It's 70 million of people in this database. And so we create an algorithm to be able to find Sjögren patients in the health insurance. And we looked at two different populations, Sjögren disease and Sjögren disease with other autoimmune disease. With other autoimmune disease, Coralie. With I don't want to be killed, so.
Tomorrow, nomenclature is for tomorrow, Valérie. Don't spoil tomorrow's presentation.
Oh no,
please.
no. So
associated will be perfect.
So we looked what's happened with Sjögren disease and rheumatoid arthritis and many others. So we create an algorithm that was adapted to our healthcare database. So it could be different if you do that in England, in Korea, or I don't know where. And we test the algorithms, and we find one who corresponds to the Sjögren patient in France. And then we apply them, and then we looked at the data we had. And what I can show you, we had a lot of results, so I cannot show you everything. I just show you, for example, a patient with Sjögren, isolated Sjögren disease. And you can see that there is a ratio with male and women, who seems to be correct. And if we looked at Sjögren with other autoimmune disease, the ratio is quite the same. But it seems to happen earlier than with Sjögren disease. We had also some results about the drugs that were used for Sjögren patients and Sjögren with other autoimmune disease. And you can see that finally half of the patients used tears drop. So sometimes it is considered that Sjögren associated with another autoimmune disease is less severe. I'm not sure about that. When you look at the consumption of treatment, it seems to be the same. Of course, we have some difference because when you have other autoimmune disease, you use more frequently methotrexate. So methotrexate is more used and hydroxychloroquine is more used. But for the other thing, it's the same. And we looked at the prevalence and incidence. And you can see it's the prevalence and incidence of the patient with only Sjögren and Sjögren with other autoimmune disease. And you can see that the prevalence of Sjögren is less frequent, and the prevalence is below 50. So in France, it is clearly demonstrated that Sjögren disease is a rare disease. We were also interested by other things, and it was by the cost. The healthcare cost of Sjögren and Sjögren with other autoimmune disease. And we were very surprised, and authorities were surprised by the cost of Sjögren. They imagined before our study that it was less. less than what we found. Of course, it's less expensive than Sjögren with another autoimmune disease, because clearly for other autoimmune disease, you have some treatment, but for Sjögren, despite the lack of treatment, the cost is elevated. So I'm, yeah, 2 minutes, it will be finished. So why counting the patient? It's very important for us to count the patient. So I just want to show you that in Europe and maybe in maybe country, I don't know for Asian, but Sjögren is probably more a rare disease. It can affect children. I didn't have time to show you, but children, not the babies, but children can have also Sjögren. And if in adults it's rare, in Sjögren it's very rare. In adults, you know that, female more than male. However, it's important to prove it. And it's an important tool because, you know, it's very difficult to do, finally, to do well. But it's important for us to describe the burden of the disease. It's also very important for us to develop educational projects and to train the doctor. It's very different to teach for frequent disease and a rare disease. You have to do different things. And also to help for national projects. And also probably for pharma, it's important. Oh, they don't want to show you why. Ah, yes, so here it is. So the first challenge after this meeting is to work together.
Good challenge, I'm sure.
Yeah, now that you are able to calculate prevalence correctly, it's correct. No, it's very important. I heard some very interesting discussion that I'm going to go back home with this discussion and to change something when I go back. So yes, it could be a challenge, but the second challenge is probably to obtain consensual data to identify Sjögren patients over time and in all countries, because we have to know if the prevalence can be modified, and we have to do that again and again because it can change. In France, there is a big project to do that following the Rare National Disease Program. And for us, it's also important to evaluate the severity and the changes of the disease. For example, in rheumatoid arthritis, vasculitis has nearly disappeared. So maybe it could be, we don't know. We want to know what is the Sjögren now and not what it was before. We want to know if the risk of lymphoma increase or decrease. It's important to take care of the patient. And it's also important to adapt the therapeutical trial. And the last change is not for me, it's for you, for the next meeting. And I was very happy to be there for the first, and I think for the next meeting, youngest people, maybe younger doctor will be there, we don't know.
No, if you come with Brad Pitt, you will be invited to the next one. Thank you, okay. Thank you so much, Professor de Vauchel. Thank you for this very interesting presentation for us patients. It counts a lot to know, because it's a subject that it's often asked, is it rare, is it not rare? So it was really, really important, I guess, for us patients to know once for all that we are in the rare disease field. Thank you. Do you have any question? Quick one. Oh, yes.
Does the EMA consider Sjögren's rare?
That's the who?
EMA.
Rare disease for EMA. Yes, normally yes, we hope so. Okay. We demonstrate. We spent 5 years before before we were recognized as a reference center. So it was in 2017. So 5 years before we send them data, etc., etc. And now it's recognized as a rare disease. That's why we are a center of rare disease.
Okay, then, thank you so much.